Separating the upper limb from the trunk. Now we are separating. From tomorrow onwards, we are not keeping the whole body, only keeping the upper extremity. So how to we are separating? One is the first. This is the trapezius muscle. Already we are removed, separate from the origin, from the spine of the spine of the vertebra, thoracic vertebra. So this is the one muscle separation. Next, another muscle attachments here. What are they? Rhomboid major and minor. Now I am separating the rhomboid major and minor. So now I am separating from this. See what are these? White color, it is visible here. Erector spinae muscles. Erector spinae muscles. It gives the support to this body. Next here also, teres minor, rhomboid minor.
Levator scapula.
Next to here, levator scapula also there, deep. Levator scapula. So now it is separated. Okay, what is this attachment here? Inferior angle. Latissimus dorsi. Latissimus dorsi. Latissimus dorsi. Now I separated. Okay. Now see how it is separating from the trunk. Now here, ventral surface of the scapula, ventral surface covered by the subscapularis muscle. One student asked, no, what is the hidden muscle? That is hidden, no? Before that, separating this rhomboid major, minor, we are not identifying the subscapularis muscle. So after separating all these muscle only, it is visible. So now I am separating. Next, after that, one of the muscle is there. Started from the 8 digits, like 8. Serratus anterior. It takes origin from the 8 digits from the rib cage, ribs. See, that is attached to here. So that also I am separating now. This is serratus anterior. Oh, it is gone. This serratus anterior I am separating from here, from the origin of the ribs. Now it is separated. What are the other muscles are attached to their remaining? Acromioclavicular joint. Next, another. What are the other attachments? Anterior 1/3 of the lateral 1/3 of the clavicle attached by deltoid muscle. That also here attachment. See, these are the anterior fibers also. Now I separated from the clavicle. So these are the anterior fibers I separated from the clavicle. Only one attachment is here. Acromioclavicular joint here. Acromioclavicular joint. Now I am separating acromioclavicular joint. Which type of joint? Acromioclavicular joint. Joint. Plain synovial joint. Plain synovial joint. Acromioclavicular clavicular joint. This is a plain synovial joint. From the acromion part of the clavicle, acromion process of the scapula. This is the acromioclavicular joint separated now. What are the other attachments? Maybe levator scapula is here. Okay, I am cutting. See, now all it is separated from there. Once again I will repeat the muscles. This is the serratus anterior. What is this muscle? Serratus anterior. Where it takes origin?
Ribs,
Ribs. Insertion where? Insertion. See, medial border, coastal surface. ये medial border है. Medial border, coastal surface. So this is the serratus anterior. Below we can identify the subscapularis muscle is there. So many students, it is confused to saying in Viva, show me the subscapularis muscle. They are saying always this serratus anterior. So you observe ventral surface having the two muscles are there. One is the serratus anterior and subscapularis muscle. This is a subscapularis. These two. Next. Whereas the dorsal or posterior surface here, above the spine is the supraspinatus, below the spine is the infraspinatus. What about this? Teres major, teres minor. Next, what about this? First, superior angle, levator scapulae, rhamnoids major, rhamnoids minor. What about this muscle? Latissimus dorsi. This inferior angle, this attachment. Here it is crossed actually. Latissimus dorsi is attached. See here the deltoid anterior fibers. Okay, anterior fibers. Hold it. I can do the dissection. See this anterior fibers of the. How to differentiate the anterior fibers? What is the landmark to separate the anterior fibers? Deltopectoral groove. Which vein is passing deltopectoral groove?
Cephalic vein.
Cephalic vein. Cephalic vein. Deltopectoral groove. This is a cephalic vein. See here. This is a cephalic vein. This is a pectoralis major muscle. This is a deltoid muscle. So these two are separated by the groove, deltopectoral groove. Through this groove, cephalic vein is going. Cephalic vein. See here, this is the anterior fibers of the deltoid. Where it is insertion deltoid? Deltoid humerus. Where? Shaft of the humerus. In which surface of the shaft? Anterior surface. There is a V-shaped tuberosity is there. So this is the deltoid tuberosity. So anterior fibers. These are the lateral fibers. These are the posterior fibers. All are fused together in the center, then inserted as a single insertion. That is the deltoid tuberosity. Okay, insertion is single. Origin is three: anterior, lateral, and posterior. What is the nerve supply to this deltoid muscle? Axillary nerve. What is the root value? C5, C6. From which cord it is emerging? Posterior cord. Posterior cord of the brachial plexus. It is a triangular muscle. These are the posterior fibers. These are the lateral fibers. Which type of fibers are present in the lateral fibers? Bipennate. Anterior and posterior unipennate muscles. Lateral wala bipennate. That's why we are calling it as a multipennate muscle. Multipennate muscles. This is the undercover. Undercover, what are the bones are here? Humerus. Surgical leg of the humerus. Head of the humerus. Acromion process of the scapula. Okay. Next. What are the muscles present here posteriorly? Okay. Supraspinatus, infraspinatus insertion. See here. This white color rotator cuff, you know, no? Rotator cuff. How it is forms? Sits. What are these? Dekho. The supraspinatus coming from the supraspinatus fossa. After crossing this, below we can identify the tendinous arch formation is there. That is fused with the infraspinatus muscle. Next to teres minor muscle. This is a teres minor. See here. This is a teres minor. So, SIT, sit muscles. Supraspinatus, infraspinatus, teres minor. These three muscles called sit muscles. It going to inserted where? Greater tuberosity. Greater tuberosity. These three muscles as well as anteriorly subscapularis muscle. So these four muscles make a rotator cuff. It is a secondary socket to the shoulder joint. This is the supraspinatus, infraspinatus, teres minor and subscapularis. These are called the rotatory cuff. Okay. What are the rotator cuff muscles? Below is the infraspinatus, teres minor. These three are going to where it is insertion? Greater tuberosity or tubercle. SIT, above downwards, like a three muscles. See, like this. Supraspinatus, infraspinatus, teres minor. These are going to inserted here, origin from the different spaces or the places of the scapula. Remember this. Next, we can do the cleaning of this.